Hello, hello. Yesterday, I had an appointment with my immunologist. She wanted to put me on yet another medication, pharmaceutical. I told her no, I wasn't going on any more medications. And let me tell you why. This right here, these are not my medications. But if I were to pour all of the medications out that they have given me over the past several years, it would be way more than that, and I just might do that. I have came off of probably 50 meds, and I'm down to 4. She still wanted to give me more shots. I told her no. You know, when you're sick like I am with Lyme disease, mast cell activation, POTS, things like that, a lot of times you don't know which symptoms are coming from your medications or which symptoms are your symptoms, because you're on so many things. And I'm just not willing to do that anymore. They tell you that things are anxiety, depression, they gaslight you, and they continue to just roll these pharmaceuticals out. I like my liver, you know. I have hard days, but I also like the way I'm living. You understand what I'm saying? Hold on a second. We have a choice of how we want to treat our conditions, and I'm just not in the mind frame anymore of gaining weight and sleeping all the time and allowing all of these medications to poison my body. I feel like we should have the right, if we want to do pharmaceuticals or if we want to do naturopathic medicines. I told her if she wanted to give me an herbal medication to help me, that would be great. But other than that, they're not giving me any more meds. And this whole entire time since 2012, in the very beginning, I took pain meds and muscle relaxers. I don't do that anymore. I haven't taken those since probably 2014. But now, the last time they gave me medications, you tell me why I want to have a medication that I have to have a Narcan shot to go with. I'm not going to do that to myself. I'm not going to put that in my body. We should have the right to get naturopathic medicine and our health care pay for it. We should have that right to make that decision how we want to be treated. I have stung myself with bees trying to get treatment. I have done what I could afford naturopathic. It's very, very expensive. I am now with an orthogonal Atlas chiropractor. He doesn't crack everything. He uses machines to, help with your atlas and your spine and things like that. And it's helped a lot, but it's already cost me over $2,000 out of pocket. But your insurance should have to pay for you to have the kind of treatment that you want. Now I understand that there are some medications people need. People are born with juvenile diabetes, things like that. But some diabetics can control it with their the way they eat and their weight and everything. I know people who's lost weight who has cured their diabetes. You know, there's a lot of things we can do on our own if we start watching what we eat, and smoothies, and just all there's so many chemicals in our food. There's so many chemicals in processed foods, and we just run out there grabbing fast foods and doing everything because it's easier. We're feeding it to our kids. We wonder why everybody's sick. We even bacon processed. It's processed. You have all these chemicals in it, and nobody is standing up. To the Food and Drug Administration about why we're being allowed to be poisoned. If I do bacon again, I'm going to the butcher shop. I'm going in a hunt of pork. Um, because I want the real thing. I'm trying to detox my body. I have gained 40 pounds from all these medications and from lack of exercise and all these things that they tell me I can't do. I have been to physical therapy. I can't tell you how many times. nothing gets better. There's spend our insurance on things that are just going to put a band-aid on something when there are actual things out there that can heal us. So if you're like me and it don't have to be Lyme disease, but most of my issues came from Lyme, and I got all this other stuff now. Some of this stuff can be put back in remission or reversed just by the way that we eat and what we put in our body. It's got to be clean foods. We got to get away from the boxed foods, the frozen foods, eating out. I'm not saying that I'm not gonna eat out. I'm gonna have cheat days or whatever, but it's time that we take control of our health. We have the right to do so. If you are on that many medications that I just showed you or more, because like I said, I have way more. Or if you're on medications where you have to have, um, did I say fentanyl a while ago? Where you have to have that little shot to resurrect you. I don't want no part of that. I don't like drugs that make me feel like I'm not in control. That's why I don't take the muscle relaxers and pain pills. I just suffer through it, which is hard sometimes. But I do have a high pain tolerance because of it. But, you know, I chose the orthogonal Atlas doctor because I didn't want to get my neck fused. I don't want any more surgeries unless I absolutely have to have them. We have got to start just taking up for ourselves. If we don't have anything to say to the Food and Drug Administration about their poisoning us, that's fine, whatever. But you have the option to change the way that you eat and to change your health, to grow our own herbs, to grow your own vegetables, things like that. I was into all this at one time. Like I said, I stung myself with bees. I grew my own herbs. I ate natural. I juiced. I did all these things. And then I listened to my doctors. I started listening to my doctors. Oh, you're not going to get any better. You're not going to get any better. You take this med. This med will help this. And then you got this medication to counteract the symptoms of this medication. You got this medication to counteract the symptoms of this medication. Then half these medications, if you look them up, they're not even supposed to be taken together. You're having issues, you're having reactions. You don't know if it's from your disease or from the medications and the poisons that you're putting in your system. It's destroying our kidneys or our liver, depending on which way the medication goes. Some go through your liver, some go through your kidneys. And we really have to take responsibility for ourselves and our own health to look these things up and to know what these medications are doing. You know, look up things that are in this bioengineered food now that we're eating and find out what the ingredients are, what is causing cancer, what diseases they're causing, because I guarantee you they're causing diseases. Start taking responsibility. I'm not saying that I will be healed. I'm not saying that all of this will change overnight, but something's going to change because I'm not going on any more medications until I can get my healthcare provider to pay for a naturopathic doctor, an herbal doctor where I can heal the way I want to. Then I'm going to do it on my own the way that I want to. It's going to be on my terms. And she agreed. I said, no more shots, no more, none of this. She said, I'm going to put you on this one shot. She said, it makes you very, very angry. I said, you're not doing that to me. Why do I want to walk around angry every day? Oh, I might feel better. We don't know if it's going to work. I might feel better, but I'm going to be pissed off every day. I'm pissed off enough. No, thank you. Take control of your health. That's what I'm going to do. I'll do more videos on this, on how I do it and how I'm getting along. God bless.